All right, well, we can go ahead and get started. And as folks join in, we'll welcome them in. But thank you so much for coming. Today, we're going to be talking about what is this Echo Hub that we're hopefully going to join in together with over the next few months. And then specifically take a look at a model that's really going to be kind of tying all of our meetings together called the single session consultation model. So to get started, we have a lot of folks, so we don't quite have time for everyone to verbally introduce yourselves, and we'd love to get to know you a little bit better. So we'd love if everyone could type into the chat your name, your organization, and your role, and then let us know how you're feeling on a scale of rubber ducky. So we've got the rubber ducky poll, kind of which one you're feeling like today. And then if you could introduce your name, your organization, and your role in the chat, that would be wonderful. And it's great to see everyone's introductions coming in here through the chat. One of my favorite things about this new Echo is that we're really bringing together folks from a lot of different settings. So we've got PCPs in the healthcare setting, we've got school and school-based health center staff in various roles, and we're statewide. So I'm really excited as we go through to get to know each other and to kind of hear different perspectives from where we're all coming from and learning from all of our expertise. So briefly, we're just going to talk about the school model and our goals, the Echo model and our goals. We'll do a brief Q&A, and then we'll go straight into the didactic on single session consult. We don't have any disclosures. So Project Echo was developed originally to get primary care physicians in rural Arizona to provide hepatitis C care on par with academic specialists using telementoring and coaching. And so instead of forcing rural patients to sort of travel into a specialty clinic and waiting months for that care, the idea is, can we bring good quality, appropriate care much faster and closer to home for folks? And this model has since really expanded through tons of different subjects, tons of different settings. Our team ourselves has done several versions with PCPs and school-based health center staff. And it's really about this moving knowledge to people instead of people making people travel to specialists, and all of us learning from each other. So it's this all teach, all learn, peer learning model. And we're really focused on sharing best practices to reduce disparities. We're going to work together to think about real cases that are coming up in your caseload, whether you be from a healthcare or school-based health center setting. And in this, we're hoping to really build a learning collaborative amongst ourselves so that we're not only sharing knowledge, but also validation, kindness, and respect. So these are the goals of our specific Echo that we're doing this series, which is new, and we're really excited about it. So we're looking to provide exposure and practice to some active tools and communication pearls that you all can apply with youth, teens, or families who maybe you're hoping to get in for more services for behavioral health conditions like ADHD, anxiety, or depression, and you have this moment, right now to really make some change. So we're going to do that by this interdisciplinary communication and coordination tools amongst all of us in these different settings. And we really hope, and what we've seen from prior echoes, is that this can help reduce our burnout and our isolation, help us feel more supported, and be able to feel that joy and that purpose in our work. So we'll come together on the third Thursday of each month at the noon hour. We're going to start each meeting with a brief didactic, followed by that discussion about, real youth and students and families that you're encountering in your work. And then we're also going to have an opportunity from 1 to 1:15 every time to, those who can stay on to do a little bit more intimate Q&A and even like role play of some of the skills or the communication pearls. So here's an overview of our topic today. We're really focusing on the overall model that's tying together all of the sessions. Then in October and November, we're going to focus on kind of what are some skills and communication pearls for those in youth's environment. So like parents, caregivers, and teachers. And then in the new year, we're really going to focus on kind of what are some tools, some skills, some ways to talk to the youth themselves. So we're always going to meet over Zoom, have some brief check-ins, have that didactic, have the case-based learning. We also have CME available. So we're going to present a link and a QR code at the end of each meeting so that you can fill out a brief survey to get credit. We also do look at your responses real time and really do try to make improvements to what we're doing in the moment. So really appreciate you filling out that form, even if you're not as interested in the CME credit or CAMFIT credit. And then again, that optional Q&A interactive time at the end. We are going to ask you all to kind of come with thoughts, questions about real youth and families and teachers in your settings. If you're sharing about these, we do ask that you don't have any protected health information and really just come open to sharing and learning. There's no dumb question. I've heard the gamut of questions from something about a specific, student or youth all the way to a broader question about working in your setting or work-life balance or burnout. So we're open to everything. We hope that you can come as much as possible. This really does build that sense of learning collaborative amongst our group. If you're able to have your camera on, that's always helpful to guide the discussions. We understand that that's not possible for everyone all the time. And really know that we're all learning from each other. We're all on a learning journey, coming to this at different points with all of the assumption that we're trying our best. Here you can see these are our hub members who will be joining us throughout the program from the UCSF CAP team. And then we're also bringing in other folks with expertise in the different topics, like we're about to introduce our guest speakers for today. But before we do that, any questions or thoughts about the overall ECHO model, how we'll be meeting together for the next few weeks?
If one misses a session or so, are there recordings that we're able to look at?
Great question. We're going to record the first didactic part, and then we won't record that more case-based learning, just so folks can really feel, comfortable sharing openly. And we'll put those on our website as soon as possible. Sometimes it takes a week or two, but absolutely. And today's didactic is a little bit different. The case discussion is sort of woven in throughout. So we really get the whole time today to kind of hear and learn and practice in the model. Any other questions?
I have another question. I know that we're learning these skills, and it's nice to see some psychologists and psychiatry also on in the group here. So how does one bill for this? Like if, for instance, as an MD, if I start giving this kind of services to my patients while they're waiting to get in with psychiatry or something, how would I be billing for my time, or would this be so? Yeah, just a question on that.
That's a great question. I think that's something that we can weave into our discussions, throughout the next few weeks. And I'm wondering if any of our team members have thoughts like Joanne. I don't know if you have any brief thoughts or if we should just plan to come back on this next time we meet.
The only immediate thought I have, doesn't work for everybody. And if you can use time-based billing to capture like the face-to-face, like kind of counseling or psychoeducation that we provide, I don't think we can use psychotherapy codes, and I don't think we should. but just the regular office E&M codes, the 99214, the 99215, the 99417, to capture that at every additional 15-minute increment that we're spending face-to-face or non-face-to-face with the patient, providing some of this counseling, psychoeducation, etc. This does not work for FQHCs because their reimbursement doesn't go up based on time.
That's a great question, though, about just how practically are we going to take some of the things we talk about. So keep bringing questions like that so we can have a discussion and learn from each other too. Like maybe there are folks who have creative solutions joining us. Thank you. All right, so with that, I am going to turn it over to our guest speakers. So we have Dr. Erica Szkody and Ian Sotomayor joining us from the Scalable Mental Health Lab. We cannot express how thrilled we are that they have agreed to join us and partner in this. This is a model that is gaining a lot of steam nationwide. And really, you know, as we were talking to all of you all about what would be helpful, this model kept coming up as something that could fit this gap of we have all these kids who need services and we're not able to get them all hooked up in a timely way. So with that, I'm going to turn it over to our guest speakers.
Thank you so much, Lauren. I'm going to go ahead and share my screen, and while I do that, I'll take a moment to introduce myself, and then allow Dr. Szkody to introduce herself as well. Hi, everyone. My name is Ian Sotomayor. My pronouns are he, they. I'm a full-time research lab coordinator in the Lab for Scalable Mental Health, which is directed by Dr. Jessica Schleider. We are currently incoming and newly established at the Northwestern University, after having spent about 5 years or so building our lab at Stony Brook University. And I've been working very closely with Dr. Szkody and our director, Dr. Schleider, to adapt our single session consultation to a healthcare population for a grant we received to offer mental health support services to healthcare workers. And we're really excited to meet with you today. I'm personally very excited to be able to offer this as a resource, as a tool, and hopefully as a way to consider what psychotherapy really means. And I'll give Dr. Szkody a moment to introduce yourself now.
Hello, everyone. I'm Erica Szkody. I'm really excited to be able to discuss the single session consultation with you and be able to kind of walk through, one, what is a single session consultation and what are the steps involved? And we're also going to talk a bit about how to actually, what are like some of the steps, not only how you can implement the whole thing, but also some of the skills that are involved that you can take away to implement even when you don't want to do the entire single session consultation. And these skills are things that you'll be able to use throughout all of your training here with Project Echo. So we're very excited to kind of get your feedback, but also be able to share some of these skills with you here. And since I know that not everyone is able to talk throughout this presentation, feel free to use the chat if you have any questions throughout the whole presentation. We'll be monitoring that chat throughout.
Great. So we can go ahead and get started. Just so you all know, today we have about 3 main goals that we want to go over with you all. The first is giving you a brief background and history on the kind of research our lab focuses on, which is on single session interventions. The single session consultation, or SSC, which you all are learning about today, is a type of single session intervention. So we'll just offer a bit more of a broad overview at the beginning. Then we'll move in directly into describing what the SSC is, what different parts are included in it, and how you could deliver it either as a whole single session or how you might think about incorporating different parts of it throughout your practice. And we will also show you all a protocol for how we deliver these and address some FAQs at the end. So to get started, I really want to emphasize why a single session approach. We often as a lab deal with skepticism from colleagues and mental health professionals about what the real utility is of a single session kind of treatment. And I just want to point out that about a little more than 10 years ago in 2011, a study proposed that there were approximately 700,000 mental health professionals in the US at that time. And at that same time, about 75 million people would experience a psychiatric disorder in a given year. And so by those measures, even if we double the number of mental health professionals overnight, we still wouldn't be anywhere near where we need to be in order to really meet the need of the current mental health crisis we're experiencing, not just in our own country, but across the globe. 10 years later, the workforce might have increased a bit, but it is likely that so has the need for mental health care, and that's not even taking into account the COVID-19 pandemic. So one of our main reasons for focusing our research on single sessions simply has to do with the fact that the need for treatment far outpaces provider availability. And furthermore, across a variety of different clinical trials, a lot of researchers find that the number of sessions, the most amount of participants typically attend, is just one. And I'm sure you all might have noticed in your own respective fields that whenever you are hoping to help someone or offer some sort of intervention or support, sometimes you might only get one interaction with someone when you first meet them or when they first present with a problem, only to just not see them again or not really know how they're going. So we think that building treatments that really capitalize on the reality that sometimes all we have is a single session can really lead to powerful and sustained change. So whether or not people intend it, they often receive a single session. And we believe through our research that single sessions can be effective. Here are just a few examples that I'm not going to go through all of them, of different research studies across time that have been kind of investigating single session interventions and their effectiveness. And research does demonstrate that the single session or brief interventions can hold at least comparative effects in terms of reducing psychological distress and improving mental health when in comparison to longer term traditional therapy. And what are SSIs specifically? We like to define them as specific structured programs that very intentionally involve just one visit or encounter with a clinic, provider, or a self-guided program. SSIs can be provider-delivered or self-guided. And SSIs are also an intentional psychosocial treatment delivery strategy and not necessarily just an orientation. It really involves having the provider, that would be you all, engaging with this idea of a single session mindset, which really just means you believe that this person already has everything they need inside of them to enact meaningful and beneficial change in their lives, and that you really believe that could happen after just one encounter. There are a lot of different ways of practicing SSI, but they all have in common the idea that all we really have is now, and right now is enough. A few key assumptions that we like to think about when dealing with the SSIs are that one, we assume something good can come from one session and one session might be the last. Two, we assume that change can and is honestly expected to occur in the moment. And three, a person already has the inner capacity to alter their thoughts, emotions, and behaviors in order to bring about the kind of significant and beneficial change that they might be looking for or need. These might all sound similar to strengths-based approaches you all might have learned in different areas of your practice, and there are a lot of overlaps in terms of really empowering the client to believe that they already have what it takes to bring about the improvements they need. So why and how can one session be helpful? Well, first of all, when you are offering a single session intervention, you might be dealing with a motivated individual, someone who is presenting in that moment for help. They are seeking treatment in that moment. And working with the motivated individuals can often lead to happy providers because you're dealing with someone who seems like they really want to be there. And happier providers ultimately lead to happy individuals because clients will most likely report greater satisfaction when dealing with someone who seems enthusiastic and excited to work with them. The positive change can also happen early in the therapeutic process. Even in traditional longer-term therapies, different studies do find that the most amount of change occurs in the beginning. And single-session interventions can reduce over-treatment. We specifically tested the single session consultation, which you all will be learning about today, for individuals who are on wait lists for longer term traditional kinds of mental health care. And when we administered the SSC to people on the wait list, some people took themselves off the wait list. They felt that the SSC, that single session, was all they needed. And so we believe that SSIs can help kind of help deal with those individuals who may not need extensive amounts of treatment. So now slowly I want to begin focusing just on the SSC. The single session consultation is based on principles of solution-focused brief therapy with adaptations here and there in order to maximize the fit to just one session and really make this as useful as possible for both kids and adults with a variety of different mental health difficulties. Solution-focused brief therapy really aligns with SSIs in that both are focused on the present and the immediate future. Both are targeting highly specific problems or a desired outcome. We're really narrowing down to something tangible, practical, almost measurable. And thirdly, both empower individuals to take the smallest step towards the desired future. We're not focusing on everything underlying the problem. We're focusing on the details that underlie a solution, just to see what you can do to begin bringing about that solution in your own life. And then briefly to conclude on our history section, I want to go over the results of some trials we've done with our SSC specifically, which we have tested both in person and via teletherapy or Zoom. When asked what these clients believed about the SSC after having received it, as you can see, a good majority reported thinking that the SSC was helpful. They appreciated the action plan that was developed. They believed that action plan was useful, and they felt motivated to use it. And lastly, they would recommend the SSC to others, which we think is a great sign to really emphasize the acceptability of this intervention. Across our studies, we noted that hopelessness often showed a 85 to 87% chance of decreasing. Readiness for change seemed to show an roughly 80% chance of increasing. And perceived agency, the idea that a person really believes they have some sort of control and autonomy of their life, also improved from before to immediately after the SSC. And when looking at our follow-up data, we noted that anxiety symptoms and depression symptoms and psychological distress seemed to overall decrease at the 2-week follow-up. So now you might be asking yourself, can I lead the SSC? Do I have what it takes? Do I have sufficient training? And like Erica mentioned earlier, we acknowledge that not everyone here will conduct a full SSC, and that is not the expectation. We really believe that the skills and tools that we use in the SSC can be used in a variety of different environments and contexts. And just like I mentioned earlier, I think one thing that I would hope for you all to take away from this is learning to engage in what we think of as a single session mindset, and really believing that a person has everything they need to have inside of them. They are fully capable, and all we need is now, and we can do something with now. So now we're going to move into breaking down the SSC, and I'm going to go ahead and take a break and hand it over to Dr. Szkody to begin talking about the specific protocol for delivering this.
So these are all of the steps that are involved in our single session consultation. And we recognize that there are a lot of steps, but we've broken it down to 3 main areas. Establishing the readiness of a client, which is what you might have already done with clients in the past, or not even clients, but your students, your patients, your friends, family members, whoever you plan on using this single session consultation with. This is where you establish what they need help with. You really understand what they hope to get out of the single session consultation, and you narrow down what it is that they want to focus on. Then we talk more about, okay, what has worked in the past and what do we need to really understand about everything that has to do with this problem. So this is really more the assessment phase. So where are we at with this problem today? And then finally, we get to the consultation. What are we going to do about it? We construct the action plan. So we're going to walk through all of these 3 main components and talk more about how you would elicit questions and exactly what to do in this action plan. And as you go through these with this patient, person, etc., we're going to take each of these steps and talk about what this would be like with a case example, using a little individual that we're going to work on together. And you'd also be able to follow along with these steps in a form called an action plan. And we'll also talk about what that would look like as well. And I'll let Ian click the button for the next slide. There we go. So these are the forms that are involved. So we have 2 forms that I think we'll send along, or they will be somewhere on Project Echo's website. There's an action plan form that is a fillable form that you can go through. It's got all of these steps in there, so you can write along with your student, or there's a online version that you should have gotten a link to as well if you want to walk through a self-guided form. And then there's also a action form that's like a provider version, which will have more of what you'll see in these slides, which has all of the example questions that you can use to help you elicit some of these responses. We also recommend using some risk assessment materials if you are using this with a client or in a medical kind of atmosphere, just to check in for things like suicidal thoughts or ideation, or if you're using this in a research area, just to make sure that there's any kind of risk involved. just to make sure everyone's safe. So the first thing that we do in the single section consultation is just making sure that we're all on the same page. So we assess for things like privacy, making sure that they feel safe discussing this content, anything about the problem with you, that they feel safe, that they're not hurting themselves, that there's no risk involved. This is an example of what you would say to this person about explaining kind of a little bit about what the SSC is. And we have a question in the chat that I'm not sure how to answer. Where do we get the assessment and action plan?
So we will link to the materials on our website, where we'll also have the recording and the slides for today. And then we will send you all a note when those are up and available on the website. And we might even attach them right there too, just to make it super easy for you.
Amazing. So after we've gotten the consent and we've done a risk assessment, we jump right into the actual single session consultation and we establish readiness. So the main component before we can really talk about anything is sharing that shared purpose, really establishing that we only have the single session. So this is a huge change from what you really see a lot in therapy, where we establish that we are not here for 8 to 10 sessions. We are not talking about everything that has ever happened in our lives. We really want to narrow down that we are only here for maybe 1 hour. We really want to focus on one thing that we can control or one thing that we can change now, to really emphasize all the change that we can make in this 1 hour. We also want to make sure that we praise this person for coming in or for addressing this thing now. It takes a lot to reach out for help. And even just acknowledging that this person wants to talk about it right now or is open to having this conversation can be a big deal. And having that acknowledgement right off the bat can make a huge difference in this single session consultation. Also, it can make a huge difference just letting them know that you're going to go through this action plan with them. Let them know that together in this hour, you're going to make a plan. At the end of it, they're going to walk away with several steps that they're going to actually be able to implement right away to see some change. And it's going to not just leave them with nothing at the end of the consultation, but hopefully they'll be able to walk away with some actionable steps that they'll be able to see some improvement in their lives. So again, yeah, so embracing that single session mindset that today, this is all we have. 1 hour, the single session can lead to some actionable change. That we're not relying on several sessions, that this one session is enough, and that this client has all of the tools that they already need. They've already overcome challenges. They already have all of the strengths that they need to overcome this problem again. We just have to help them find that in themselves again. The next, which is something you probably have already done before, is you're going to help them find their top problem, the reason why they came in the first place, so the reason why they came to you. So these are some examples that we've had before. So individuals have come in before and they've said things like there was a global pandemic and that was why they reached out for their single session consultation. And you want to help them kind of rethink this as something that is modifiable and something that they can actually address in this 1 hour. So for example, this clinician helped them to reword this or reframe this as, I worry constantly about COVID and feel unable to stop. So this is something you could see that they'd be able to modify as worrying constantly and feeling unable to stop. They'd be able to kind of think of some coping skills. Or another example is someone came in saying, nobody at school likes me. And they were able to reframe that as, I am struggling to connect with people at school. We want to reflect and validate. We want to honor what this person's problem is right now. We're not trying to fix anything yet. We're not trying to put words in their mouths. We really want to acknowledge that what they are coming in with is what they want to focus on. We are not trying to diagnose with anything. We don't want to get their entire life history or an entire background. We really want to narrow it down to one specific small thing that we can focus on. And then, of course, we want to record this on the top problem of that form.
My bad, Erica. I
You're
can go
good.
back.
Go ahead.
I'll jump in. I'll be helping Erica as we go through the SSC by jumping in, and this will be essentially our case presentation for you all. Is we want you to meet Sam, and I want everyone who's on this call to imagine that you are currently a provider at an SSC clinic near you, and someone new just scheduled an appointment to meet with you, and this person's name is Sam. Now Sam, now I want everyone to think about something that you're struggling with, or maybe a coworker, a colleague, a friend, a child, and who's really struggling with something as well. And then if anyone is so brave as to unmute or raise their hand, I encourage you to shout out some ideas as to what Sam's problem could be. And then as Erica continues to go through the SSC, we'll demonstrate to you all how we might speak with Sam and address them if we were meeting with them, if they were our own client.
There's no wrong answers.
It could be anything.
Dealing with mom, or like mom arguing with me rather.
Okay. Ooh, my apologies. Okay. So dealing with struggling with mom, maybe getting into a lot of arguments with my mom. My mom doesn't get me. She just doesn't know where I'm coming from. That could be a top problem. Are there any other ideas, suggestions? If not, that's okay.
I like that one. I feel like it's relatable. We've all
Yeah, we
worked
can run
with
with
our mothers at some point.
So let's imagine that Sam came in to meet with us. We established a shared purpose. We reviewed what an SSC is, and we only have this 1 hour. And now we're trying to get into like, what exactly is your top problem? Like, what's your reason for coming? What can we help you else with? And Sam lets us know, like, dang, like I just keep getting into fights with my mom. Like, I don't know if she's picking on me. Maybe she doesn't like me anymore. But like, things have just been kind of getting really stressful, and I don't think we're on the same page. And honestly, like, it's making me worry. I feel like I spend a lot of my time stressed at home, and I'm hoping for some help with that. So I'll pause there, keep that in mind as Sam's problem, and we'll see how we can best help Sam work through this as we go on.
So the next thing in the SSC is identifying the person's top hope. So it's the positive opposite to the top problem. So this is what we hope to get out of the SSC. So for example, if this is the opposite from the problem, so if you left the SSC today, what do you hope you would get out of it? So for example, the opposite of I worry constantly about COVID and feel unable to stop, this individual said, I hope to learn how to get through my worries just a little bit better. I hope to get better at reminding myself that it's okay and normal to worry. I hope to forgive myself at least a little bit for worrying during a stressful time. And then the individual who said they were struggling to connect with people at school said, I hope to make a plan to connect with people who are like me and accept me as I am. And then you would record this as their top hope on that same action plan.
Okay. So we've identified Sam's top problem as being getting in too many fights with their mom, not being the same page as them. Now I'm curious if anyone in the audience, imagine you had a child come to you and tell you that that's their top problem. Do you have any ideas as to how we could frame that, or what the positive opposite would be? How can we think of a top hope out of that top problem?
think have improved interaction with mom. So the top reason for seeking services would be arguments with mother or conflict, if you want to put the word conflict there, conflict with parent, right? And I think the positive would be, I don't know if you could eliminate all conflict, but maybe like um, uh, have a more amicable relationship, but it's too vague. I don't know how I would make it more specific.
If I may, I really like what you said with we can't avoid conflict. I always tell people that a good life is not a life without stress. It's one where I respond to stress well. And so I wonder if for our top hope, maybe we can acknowledge, like teenagers growing up, there's it's common for there to be like some distance from parents and you're growing into your own person that can be hard sometimes. So maybe the goal, let's keep it realistic. It's not to never fight with mom, but it's maybe learn how to like respectfully disagree with mom, or learn how to express myself in a way that feels true to me, while still like being mindful of my mom's boundaries. Something along those lines. I like the way you put it.
Right.
There's a comment in the chat of, I hope to be able to talk with my mom without her yelling.
I love that. That too. I think that leaves space for the reality that there might continue to be some disagreements as you grow up, but I think still aiming to like, wow, like maybe we can talk without having to become an argument.
So
I
quick
love that.
question. Would you kind of delve into why the argument is there? Because maybe the argument is they don't clean their room or their grades are falling. Or what if the argument is more about, let's say the parent expects more, but the patient is doing bare minimum, is doing average, but not getting an A. So there are two kind of times where they have, so sometimes some kids are just, maybe they're trying weed, maybe they're doing some other things, and the arguments are there. Would you go into why the arguments are there?
It's going to depend a lot on how much time you have. Remember, this is only a single session consultation, and you're also there to serve the person that is coming to you. So if this is the child that is coming to you wanting help with the argument, you're there to serve the child in that need. And if they are distressed by that argument, sitting there and talking to them about their grades and about their substance use and really starting to interrogate them about all of the things that could be going on that's causing the argument might get them to shut down and not want to disclose further. Whereas, and kind of shuts you down to any other further progress, which is a choice, but also, unfortunately, then further it stops any progress that you could be making in the SSC as well. But if you do have time, you can always delve into those questions later on when you get to the action plan as well, of like, well, when we start to talk about those coping strategies of how you're going to talk to mom, maybe setting up some extra boundaries or kind of figuring out what's causing some of those arguments or situations in which those arguments occur. Because we do have a section later on about like exceptions to this conversation of when these arguments are going to happen. That might be a part to kind of delve into that a little bit more in depth.
And I just want to briefly add that you also might find yourself exploring a little bit of that in the previous section when identifying the top problem. I saw in the comment there was a question about some guidance from getting to a big global problem to a very specific one, and that one can be a little tricky depending on who you're working with. Some people really just might like, everyone hates me, everything is hard, I can't live anymore. Like that's it'll take some prompting from you for sure. But I definitely think that as like if they say like, oh, my biggest problem is I keep arguing with my mom, like if you talk with them a little more and they're bringing up, oh, you know what, and I've been falling behind at school, my friends aren't liking me anymore, I've made these new friends, they keep doing things that I think are weird, that conversation might lead to you asking like, oh, like it sounds like there's a few different things going on, which one would matter most to you right now? We can only focus on one problem for now, and so if you had to pick out of all of them, which do you think is the most important? And from that alone, the youth themselves might tell you like, oh, like I really want to focus on this. So I will shut up now and let Erica go back to the presentation.
No, these are excellent questions. I also saw one about focusing on from the big global problem down to more specific. And I know that you had mentioned as well about the can't avoid conflict in total. So that's another thing of you can't avoid some of the big things, but being able to focus down from the top problem and the top hope of something that is modifiable in that one session or that 1 hour down to something you can control or can change within these 3 steps that we'll be able to do in the action plan. So from here, this is what the actual form looks like for this top hope and the top problem. So this is what you would look like in the action plan if you wrote it down, or in the online form without the little Sam in the corner. So the next step we have is moving from that sharing of a purpose down to what are we doing here today, or where are we today? So delving into it a little bit more in depth of, we pose the miracle question. So if you had this problem and overnight everything cleared up, a miracle occurred, and while you were sleeping, your reason for services just disappeared, and you woke up, how would you know that there was a change? How did you know that that miracle occurred? What are you doing, thinking, or feeling that's different? And this can really help us to understand maybe some of the ways that the distressing problem is really impacting them, or some of the ways that they are coped in the past that has maybe no longer occurring. And I think we have some examples. Or not.
I'm sorry.
So
Go straight into this.
So some of the examples in the past have been things like I wake up in the morning and I don't have to see that coworker, so I'm no longer stressed out at work, or I'm not in pain from my chronic back pain and I get a full breakfast. I'm in a great mood. I have my favorite outfit is clean and out of the laundry. I have a good hair day. I have, free donuts at, Dunkin' Donuts or something. Everything goes my way. These can provide you great insights for later on, and really tell you a little bit more about how this problem is influencing their lives.
And now, I want you all to imagine that you are a teenager and you're having arguments with your parents as you are learning to develop your own identity. Imagine you're going through this and a miracle happens. So you wake up the next day and boom, the issues you've had with your mom are all gone. Like Erica mentioned, no one bothers you. You wake up feeling great. You put on the right song. But I'm curious, what do you all think you would feel or think, or what you would do the next day if you were in a similar situation as Sam and then a miracle happened? I'm curious if anyone here would be willing to offer an example as to how you think you might feel or think differently the next day.
Be lighter.
Okay. That's okay. That's okay. We've feeling lighter is definitely, I think, a main one. I think you would definitely, especially in this context, maybe you would wake up without the sort of stress or like worry, like, oh my God, if I see my mom again today, like, is she gonna say something to me now? Is she gonna wake up feeling mad at me today? Is she gonna be cool? Can I wear what I want to wear? I wake up and you know what? I look at my closet and I feel like I can wear anything. My mom has been fighting with me a lot because of the clothes I've been wearing, but that problem's gone. So I think I can just wear whatever I want. Those might be the kinds of things you look for in the person you're seeing. And I just want to emphasize, you really want them to be as vivid as possible so they can really imagine what life would look like and feel like if this problem was gone for them.
And you got some examples from the chat as well. I'd be able to concentrate at school, get along with friends because I'm less stressed about mom. I wake up and I feel like she likes me, like when I was a kid. I feel like I would definitely hear that from a child. And then we want to be able to give them something that's measurable. So we ask them to create a scale based on this miracle question. So on a scale of 1 to 10, with 1 being nowhere near their goal of that top hope and 10 of being, I feel amazing, everything is perfect in my life. Where are they now? So asking them here of like, can you quantify how close to your goal are you? And then once they tell you like, I'm at a 4, asking them to describe exactly why did they decide that they're at a 4 and not one step higher or one step lower. And this can tell you a lot about how they really see themselves now and what would take to get them a little bit higher on that scale. So for example, if they say, I'm a 4 today, and I say that I'm a 4 because if I was at a 5, I'd be getting a little bit more sleep, or I'd be eating a little bit better. I would be talking to so-and-so. I'd be doing yoga every morning. All of these things that they're listing for you are telling you, well, these are coping strategies that you could be using later in this plan to really be helping improve their life. So for examples that we'll probably use later. So for Sam, for example, maybe it's like, well, I'm at a 4 because my mom yelled at me this morning and we argued all the time and we never used to argue. And it'd be so much easier if that didn't happen. So yeah, so Sam's at a 3. So maybe Sam says that they're at a 3 because mom yelled just this morning about something stupid and we can't remember what it even was about. And we never used to argue first thing in the morning and it's just not fair. And I can't remember the last time we didn't argue first thing in the morning. And that tells you like, okay, if we could get that not to happen in the morning, if we did something different to change that routine, that's amazing. That would be one thing that we could make Sam one step higher or one step closer on this goal. And then we can just ask more questions, like earlier someone mentioned, about what is causing these arguments and really open up that conversation a little bit more. Or maybe Sam is saying, I'm a 3 and it had nothing to do with mom of, you know what, I'm really cranky lately. I don't know why. I'm just not sleeping really well. I feel like my body hurts all the time. I can't concentrate at school. Everybody's really mean to me. And it's telling us there's all these other things that are also stressing them out, as well as mom.
A quick question.
Yeah.
What about if the thoughts are more like, I woke up and I think mom hates me? And it's not that mom did anything, nothing happened, but they think that that's the thing.
Mm-hmm.
And they believe it. I mean, how do you rate that?
What do you mean? How would we? It's the same. It would be the same thing.
I just meant like, so there's nothing really happening as such, but these are all intrusive thoughts that they have themselves. Does that require a different action plan versus, or it's just the same?
It would just be the same action plan. It would just mean that we might focus those action steps on different tasks. So we might focus them more on like a behavioral therapy kind of options. So we might talk more about like journaling or really thinking more about like reframing those thoughts in a different way instead of maybe behavioral tasks like talking to mom or maybe doing like activities with mom in a different way. So maybe doing more introspection about like where are those thoughts coming from and maybe attacking those in a slightly different manner, if that makes sense. So this is
And I
definitely.
just want to jump in.
Oh, sorry.
Oh, I'm sorry. There was a delay on my end. Please finish.
I was just going to say that like the action plan can definitely be anything that you want it to be. It can be tailored to any type of therapy interventions that you would like. I did notice that in the Project Echo plan that you're going through, there's many different therapy techniques that you'll be going through. The action plan steps can be tailored in any different way. I know that the different activities that people choose are also much varied, especially across age groups, that teens often choose activities that are very much centered around their friends and fun activities, where adults often choose to do more introspective activities on their own. So I know that that will change depending on what populations you're working with and kind of the different concerns that people will have.
And I was just going to mention that I really appreciate you brought that up, Dr. Ahmed, because I think that that in of itself might come up during the miracle question. And as you develop the scale, where whether or not Sam said at the beginning, "Oh, I think my mom hates me," if you're asking Sam, like, "Hey, a miracle happened overnight. Like, you woke up, like what would tell you that things changed?" If Sam said, "Oh, like, mom wouldn't hate me anymore," or something like that, I think that would be a key into like, oh, like it seems as though Sam believes that Sam's mother hates them. And like Eric mentioned, there would be opportunity later on in the action plan to kind of get at different things that Sam could do to narrow that into something that's in Sam's control, and then give Sam the opportunity to do something about it that's actually feasible in order to help deal with that sort of feeling.
So this is where we would explore exceptions to the problem. So for some individuals, you can skip this because they will have already explored some of these things. So for the scale, if they're like, I'm a 3, I feel great about it. I know exactly why, and they explore those things automatically. For Sam, it's kind of talks about, we've already kind of hit on those, that there may be some more exploration if they say things like, I feel like my mother hates me, or if they don't know why they're at a 3, or they haven't been able to kind of express that in a way. So we've given you some examples here about how you can explore that in different ways. Like, can you recall a time when you thought you would be overwhelmed by this problem and you weren't? Or can you remember a time when you were even at 1 point higher on the scale, just to help them really understand of why they were here or not. And since we've already kind of explored some of these exceptions, we'll kind of skip through here a little bit. And then, so now you've already kind of established this shared purpose. We figured out what we're here for. Then you get to finally construct the action plan. So here you're going to step in, and this is where you get to finally actually provide some tips and come up with 3 steps and be very specific about the when and where they can actually take actionable steps towards getting 1 point higher on that scale towards their overall hope for the session. So these, again, they can be any type of therapy intervention. They can be any type of activity that they would like to do. And we try to be as specific as possible. And some of these are not as specific. I would actually suggest being a little bit more specific. So for one of these examples, it says like, plan 1 enjoyable activity per day, sometime in the morning or late night at their home. I would actually suggest being maybe a little bit more specific about like what activity, and maybe even like an actual time that they would be available. Like, right when I get home from work, I want to go for a walk with my dog. Another thing that they suggested was they want to schedule a social activity each week on Fridays at their home. And then another one was attend a social or dance class on Instagram Live or Facebook when it's scheduled at home. This is another one that I would suggest maybe in the session, finding a dance class on Instagram Live or on Facebook together, and like looking through and like, okay, this one is scheduled on Friday. You're going to go to this, like with this person, it's like 2:00 or whatever. So that you know, like you have an actionable time of when they want to actually engage in this. And then to help hold them accountable, we also want to help them find at least 2 people or resources that they can connect with once they are done with this session. So since you don't have 8 to 12 sessions of a therapy, we don't want to just leave them feeling like they have to do all of this action plan on their own. So you want to be able to provide them either with people that are like in their cell phone or on their social media that they can connect with and be like, hey, let's do these activities together. Or I can call these people if I need it. So this is someplace that if they don't have somebody, you can also just provide them either with a crisis line, text lines. If you have a resource line at your institution, this is also a great place to hook up with some of those resources. And then I'll let Ian hit the next button since he really wants to.
I was just going to say, for the sake of time, we're going to move to this. You can imagine, based on everything Dr. Szkody just said, how you might fill this out with Sam. And you would just think about thinking about things that they have mentioned before as exceptions to the problem. And like, hey, in the past, you mentioned you did this when you thought you were going to be overwhelmed. Would that work here again? And et cetera.
And then lastly, we have everyone has been setting goals all their lives. And we know that it's not always easy to follow through with our goals. So we want to kind of step in and help them think ahead of what are some of the barriers that stopped them from enacting on their goals in the past. So we walk them through what is an inner obstacle that they've encountered. So something, either an inner belief, a bad habit that stood in their way, or maybe a thought, or just something that's in their environment that stopped them from attaining these goals in the past. So we think of this like their inner obstacle, and then what is an action or a thought that they can take that when that obstacle comes up, that will help them through. So for example, if in the past, sorry, you're going real fast. So we had one person who said that their inner obstacle was that they feel like they don't deserve it or don't have enough confidence. And so they thought that their new thought will be, am I going to really die if I do this? And we phrased that in their new if-then statement. So if they have this thought of, I feel like I don't deserve it or don't have enough confidence, then I'm going to remind myself, am I really going to die if I do this? And then to be kind to myself.
And for the sake of time, I'll also skip over Sam's example for now. And I think that it brings us up to the, last part.
And then the last thing that we have is in the action plan. So as you're filling this out is a note to the person. So we want to be able to leave them with some note of encouragement. So again, you don't have those 8 to 12 sessions. So this is a note, 1 to 2 sessions from the clinician or the provider to this individual. And if you're not actually writing it out, this could just be something that's spoken, of a reflection of how you think they're going to do towards these goals. Something that you've noticed based on everything that they've shared. So things are like, I've recognized how like you easily like saw all of your own strengths and you came in and you were determined and motivated. As you said, your attendance at this consultation meant that you are being productive, which shows me that you're capable of making these changes. Love it. I wish you the best, and I know that you can do this. This gives them that kind of vote of confidence on top of being able to walk away with that action plan, knowing that they do have your support, as well as that support of those 2 individuals and that action plan in their hand as they walk out of this consultation.
Thank you so much, Dr. Szkody and Ian. So that was a really great overview of the single session consultation. We just want to remind everyone that at the end of our pre-evaluation survey, we have a link to an online self-guided single session consultation that we are really encouraging everyone to take. This gives you a sense of what does it feel like to be the recipient of a single session consultation, and I think also helps you envision how you could use the whole model down to even essences of parts of it with the youth and the families and the teachers you work with. So I linked that directly here. It's also linked in the end of the pre-evaluation survey, which we have a gift card raffle for. So thank you in advance for filling out those surveys, for trying that activity. And next month when we meet, we'll be talking about what are some specific skills or tools that you can use with parents, caregivers, and adults to improve the lives of young people. And we'll be kind of talking about how to weave those in when you're working with those folks in a single session mindset. And so we will hang on until 1:15 so we can hear a bit more from Erica and Ian about kind of when to use single session, how to use it, and we can also have you all be able to ask some more questions, and even if people want to try role playing based on questions that you have in your practices. Thank you so much. Those of you who have to sign off, we'll see you hopefully next month, and those who can stay on, excited to chat more.
I just wanted to ask one question. To what extent has this format actually been trialed in primary care settings? Do you have any experience there?
Yes, we have been able to trial it all throughout the United States in 6 different primary care settings, as well as overseas in the UK, Africa, and it's being set in China right now in a primary care setting.
Were there key lessons learned from those pilots as to what makes this feasible or not? Because I can't imagine it fitting into 15 minutes, for example, right? Like, what adjustments did they have to make to actually make this feasible?
So we've done 2 kinds of adaptations. One where they have the option of doing a self-guided form, where they're able to just kind of get a link and walk through it while they're in the waiting room as they kind of sit and wait, which is about a 15 to 20-minute option. As well as just being able to kind of go through with another provider as they're waiting, which is if you kind of opt into that option, which it's it's a little bit of a difficulty as far as implementation goes. And then we also have the option of it's an actual appointment that you can make where you decide that you want to sign up for a single session consultation in replacement of your regular primary care visit.
And I'll just add that our team is hoping to develop some online self-guided versions for parents, teachers, and youth that you all could potentially try out in the kind of that first method that Dr. Szkody mentioned. We're hoping to be able to give those out by the end of the ECHO series. And also, I really appreciated what was talked about at the beginning about the single session mindset, that even if you're not doing the full single session consultation, how can you really help the person in front of you think through what's their main problem and what's a solution that's within their control, that even taking small steps using tools already in their toolbox or things that have worked for them in the past, or maybe some skills and tools you're learning in the ECHO series could help make some change in the moment. Yeah, Judy.
Seeing this as maybe a potential for follow-up to a well child visit where something gets elicited as being a big concern and problem, but you don't have time to deal with that today. And then if you could get something scheduled in the fairly near future, is that an appropriate use for this kind of tool?
Of course.
It doesn't have to be that day or at the moment they're having the concern necessarily.
Of course. No, you'd definitely be able to use this as a follow-up if you'd like.
Mm-hmm. Yeah, because so often things come up, but there isn't time to deal with it then, but it really needs to be dealt with.
Yeah. And this is also something that even though it's a single session, you could also use this multiple times for multiple different problems, because it is that solution focused therapy, as long as it is just designed for one specific problem.
How long does this take?
Okay.
If you walked through this with a youth, how long would it take?
It's going to depend on the youth, but it's going to take anywhere from about 30 to 45 minutes.
And
So-
again, I'd encourage everyone to try the online single session and see how long it takes for you to walk through it.
Yeah, it really depends on how chatty of a youth is. If they really want to talk about everything that's going on and they really get into it versus a teenager that's just like, yeah, things are great. I don't know, sure. Which I feel is any therapy session that you have with a youth.
Yeah, I was curious about that piece of like the clinical piece. Like, do you notice a difference in the success of the single session based on the clinical training? Like,
No, actually,
oh,
we've been able to
interesting.
test it and with lay providers, with healthcare workers, trainees, as well as with trained licensed clinicians, and we have not seen any differences in the outcomes with our actual like participants.
So how do you explain that? Because just like the tools that you're using are so evidence-based and like really strong tools, or is it?
Yeah. And the action plan, it really is like step by step. We really walk you through
Mhm.
all of the ways that you can elicit all of these responses. So if somebody says, I don't know, the action plan for the provider really walks you through like all of the different ways. Like if they do say, I don't know, you could say these 5 things. If they really don't know how to explain something or they really can't come up with a top hope, these are all the different ways you can explore it. If they don't know how to come up with like an exception to the problem, these are like 20 different responses that you can ask. So we really try to help you out if you are not used to getting all of that background information. So we don't
I
want
know
to.
that is that I've noticed in when training providers who are not already training as therapists or healthcare or like a mental health professionals, there might be some concern about a risk assessment. But that even if you are like not a mental health provider or facility, but you're looking to like integrate this as a service that's offered, I would encourage you to think about the risk assessment or in terms of like how you frame the SSE and acknowledging that like this can be for anyone. If you are dealing with crisis, this is most likely not going to do much to deal with that. But I will say in conversations I've had with our director, Dr. Jessica Schleider, she has mentioned instances where the SSE has been used people who might be dealing with more severe kinds of struggles, maybe a severe mental illness, or maybe they have a history of suicidality and hospitalizations. Jessica made it very clear that the SSC is still helpful to them, even if they are dealing with a bit more like high stress. The provider just has to be conscious about like, like this is one session and I'm asking you to choose like what you want to dedicate this one session to. So I definitely think it is very adaptable.
I have another question. I'm perseverating on my well child visits and how often the parents bring up something that they want so-called fixed in the child. And I'm just curious how I could parlay a visit like this into like bringing the kid in to kind of help give them some support and some tools and I don't know that they would necessarily be the ones seeking the intervention though. And so it may not be, I don't know, just curious if you have thoughts on that.
Yeah, I think that the single session consultation could be something that you could offer as like a maybe, I don't know, it'd be more like just of an extra service. I wonder how I would pitch that to a parent. I think I would offer it more of like an extra support of like, I understand, like, let's say they want them to, I'm trying to think, like, so fixing like my kid is talking back all the time or something like that.
Yeah, they're not motivated. They're not doing their best. They're not this. They're not, they're talking back. They're fighting with me. They're not telling the truth.
That makes me think about the preference the SSC and solution focused brief therapy both have for focusing on the solutions and not problems. And I don't want to demean what you're pointing out here, Judy, but I do wonder if in those instances, if you want to introduce the SSC, I wonder if it would be useful to you and your colleagues to introduce it as like, oh, like this is an extra service, where we can think about what you're talking about, but we're going to focus on the solution instead of the parents saying, oh, they're just really lazy. They just never listen to me. Instead of like, okay, let's find out why they're lazy. But like, oh, or how do we fix their laziness? You could think about like, oh, like what could be leading them to feel so like unmotivated, and like what do they say is the problem? And that would be more down the line, but I wonder if there would be opportunity for that reframing there to like, okay, I'm hearing you say this, and I'm not going to validate what you see as a parent. But I wonder if it would be most helpful for us to focus on this because I think it could underlie a solution.
I
Yeah,
like
I
that.
think those are
Yeah.
great points. And, so our next two sessions are really focused on how to work with parents, caregivers, and teachers in supporting youth. And we're going to talk a lot about that, about how to kind of talk with folks and parents about, how changes that they can make that will actually improve the behavior of their child. And so I could see it going either way, where like you use the single session consult to really focus on those changes that the parent caregiver can make, and or potentially offer another one for the youth.
I did want to, I saw in the chat about the 45-minute time frame, is that you can also shorten the action plan to only focus on maybe one of the steps instead of the three, and take out that like exceptions to the scale, which can definitely shorten things down a bit to match into a shorter time frame. And then just make sure that you're kind of shortening everything down, or maybe just using some of those skills instead of using the whole consultation as well, which could definitely make it into a much shorter visit if needed.
That's really great to hear. I wonder if we can even work on modifying a shortened form and then making that available for everyone.
Because I do know that's a lot to try to get through.
Well, thank you so much, everyone. Any last questions or thoughts?
I was just going to say, I wonder
Thanks.
too about shortening it to just like some of those skills that are kind of motivational interviewing skills, like giving those tips of like empathetic listening, don't give advice, like, so at least they have those things.
Mm-hmm.
The essence, like you said, that's so strong.
Yeah, that's a great point, Marielle. And that's unfortunately our last session, and our last session to sort of tie everything together is how to use those motivational interviewing strategies to really
Okay.
elicit change in the people we work with.
But thank you. That's a really great model. I'm impressed. Thank you.
Thank you for coming.